Okay, so my presentation is on the transposition of great arteries. For some reason, my PowerPoint does not have the option to record, so we're just going to do it like this. Here we go. The transposition of great arteries is when a baby is born. It's basically a rare congenital heart defect where the pulmonary artery, instead of it being connected to the right ventricle, where normally blood will go from the right ventricle down to the lungs, back to the left atrium, then the left ventricle, and pumped through the aorta to the rest of the body. It's where the aorta and the pulmonary artery are switched. So the aorta is connected to the right ventricle and the pulmonary artery is connected to the left ventricle. In this condition, basically blood is being pumped to the body before it gets to the lungs and gets oxygenated. So the baby will present with cyanosis, difficulty breathing, really low O2 levels in their blood, like a pulse ox, it would be really low. Cyanosis, obviously, it would be central cyanosis, where the baby's face and belly are even blue, not just their hands and feet. A respiratory therapist could be involved in their care just because of the difficulty breathing, the increased need for oxygen, and really the only treatment for this disorder is surgical intervention, where the baby would be taken into surgery and those arteries would be put back where they're supposed to be. So the pulmonary artery would be connected back with the right ventricle, and the aorta would be connected back to the left ventricle. And respiratory therapists may be involved with, the treatment of the baby after surgery as well, if they're still on a vent or anything like that.